A case conceptualization of general. Meet Sarah. Sarah is an elementary school teacher spending her days working with children. Sarah appears to be a typical 32-year-old American woman with a promising life and career. However, Sarah faces an internal struggle every day that is experienced by many: anxiety. After struggling alone for 8 long months with persistent worry, uncontrollable anxiety, restlessness, fatigue, sleep disturbances, irritability, and muscle tension, Sarah realized that her problems were beginning to affect multiple aspects of her life. It was time to ignore the stigma surrounding mental health and seek help, taking the first step to finding answers by meeting with a therapist. Upon meeting and talking with her newly found therapist, Sarah was finally at ease with her decision to seek help. The therapist was warm and inviting and earnestly listening to the problems she had been having. Sarah finally felt as if she had met someone who did not judge her for being different, but rather seemed to understand exactly what she was experiencing. Sarah's therapist assured her that ethical considerations were in place, stating that any and all private information would remain confidential. All possible treatment options would be made available, and each session would begin with informed consent of an explanation and Sarah's authorization and approval of any and all assessments and treatments. Sarah understood the limitations of confidentiality requiring the therapist to report risks such as potential danger to herself or others and diverse legal issues. Sarah was pleased that her therapist took the time to explain this to her and found herself relating to her therapist through her experience as a teacher, which strengthened her newfound trust in her therapist. When the session was completed, the therapist commended Sarah for her display of strength and action, inviting Sarah to return for another session to complete the assessment battery and discuss the next phases. Sarah was excited to get started. Her next sessions consisted of addressing her symptoms further through what the therapist referred to as an assessment battery, consisting of assessment tools in the form of questionnaires. The therapist explained that they would begin with Diamond, which was a semi-structured interview addressing cultural factors, developmental age, functioning impairments, and presenting symptoms, followed by three additional questionnaires. The first questionnaire, the Penn State Worry Questionnaire, was used to assess Sarah's experienced worry. The second questionnaire is the Beck Anxiety Inventory, measured Sarah's cognitive and physiological feelings and experiences. The third assessment tool, the Generalized Anxiety Disorder Scale, or GAD-7, assessed the severity of Sarah's symptoms. Although Sarah had worried about how she had performed on the questionnaires, she was relieved to find that her next session finally brought answers. Her persistent daily struggle with worries and anxiety, along with her physiological ailments, were in fact symptoms of a psychological disorder known as generalized anxiety disorder. The therapist went on to explain that the diagnosis was concluded according to DSM-5-TR criteria. Sarah learned that her diagnosis was based on her distress and experience of uncontrollable and excessive worry and anxiety that had been occurring over the past 8 months, along with her restlessness, fatigue, irritability, muscle tension, and sleep disturbance causing dysfunction in her daily life. Sarah was relieved to learn that her deviance from the social norm of maintaining healthy interpersonal and professional relationships was explained in the diagnosis criteria. Sarah also learned the dangers of declining treatment for her disorder, such as developing suicidal tendencies, physical health difficulties, and further impairments in multiple life aspects. Informed her of the differential diagnosis considerations to offer Sarah confidence in a definitive diagnosis. For example, she learned that social anxiety disorder had been ruled out because Sarah experiences anxiety and worry throughout multiple life aspects, and the length of her symptoms experience ruled out major depressive disorder. According to her therapist, her symptoms were not better explained by another mental disorder. However, Sarah was still at risk for comorbidity if her symptoms were left untreated. According to Vital et al. 2023, anxiety disorders are more common among women, and it is culturally acceptable for women in the U.S. to discuss and seek treatment for symptoms of relating to anxiety. This evidence implies that Sarah's experience is considered socially acceptable by reason of gender, resulting in the likelihood of continued help seeking for her reported symptoms. Also, Sarah's gender implicates confined comorbidity, specifically to anxiety disorders and unipolar depression, according to the APA. This evidence suggests that as a female, Sarah is more likely to perceive her symptoms and diagnosis with heightened emotional complexities. The encouragement and acceptance is considered the social norm for women. However, this negatively reinforces her perceptions. The intersectionality of patient perception and ethnopsychology highlights the necessity for recurring assessment batteries targeting potential diverse diagnoses. Additionally, as an elementary school teacher, Sarah is likely to experience burnout. Her occupational role could be contributing to the enhancement and continuity of presented psychological and somatic symptoms. As a 32-year-old female, Sarah is likely experiencing many stressful and uncertain life aspects and changes congruent with early adulthood. This could significantly impact symptom development occurrence. For instance, changes in physiology, placing greater emphasis on career development and establishing lasting romantic partnerships, are common aspects that should be regarded in Sarah's case. Although Sarah is relieved to finally have an answer, she found herself worried about the next steps and how others would perceive her. Her therapist assured her that she was not alone. Sarah's therapist encouraged her to join support groups and informed her of many online resources available for women with GAD. Sarah felt relieved to know that there were additional resources for help available to her, and she was delighted that her therapist encouraged family support by offering family and peer education on psychological disorders as well. Confident in her understanding of generalized anxiety disorder, Sarah was ready to give her consent to continue forward and begin developing a plan for treatment. After discussing current coping mechanisms and strategies for dealing with symptoms, Sarah's therapist explained multiple treatment options, including biological, psychodynamic, and cognitive behavioral approaches. The biological approach considers factors such as genetic, neurochemical imbalances, and brain structure and function. Sarah presents with symptoms that are congruent with neurochemical imbalances and dysregulations within brain functioning. CT screening and MRI imaging testings would be used to consider treatment options for with medications such as SSRIs and SNRIs. The most notable limitations of the biological approach for Sarah's case are the side effects caused by the medications. The psychodynamic perspective holds that Sarah's persistent anxiety is an unconscious and that maladaptive unconscious cognitive processes rooted in interpersonal and intrapersonal relationships from past and present experiences cause unwanted behaviors. The psychodynamic approach also suggests that anxiety is the result of the unconscious mind's attempt to protect itself from recurring past traumas. Cognitive dissonance resulting from ambivalent feelings produced by differences within the mind is the reasoning that underlies maladaptive behaviors and responses. Treatment approaches include psychodynamic therapy such as talk therapy and transdiagnostic psychodynamic treatment. For Sarah's case, it is important to uncover any suppressed traumatic occurrences in Sarah's past that are potentially responsible for the development of her maladaptive self-conceptualizations that could likely be projections of emotions felt by Sarah as a child in response to her interpersonal relationships with caregivers. Limitations to consider for the psychodynamic approach include the lack of supporting evidence for treatment success and the lengthy treatment sessions. The cognitive behavioral approach defines anxiety as a result of the interconnected relationship between maladaptive thoughts, behaviors, and emotions. Sarah's cognitive distortions are undoubtedly affecting her emotional responses and behaviors. Cognitive behavioral techniques such as cognitive restructuring and behavioral modifications would prove ideal in addressing her symptoms. For instance, Sarah demonstrates negative automatic cognitions triggered by anxiety-inducing situations, which result in maladaptive behaviors. By challenging and restructuring Sarah's cognitive patterns While also applying behavioral interventions, it is possible to target and alleviate and potentially eliminate the present psychological and physiological symptoms. Limitations of CBT include lack of in-depth analysis of behavior and cognitions and lack of biological considerations. After considering her options, Sarah decided on a treatment plan focusing on cognitive behavioral restructuring through CBT, incorporating talk therapy sessions to address her early life experiences and biological treatments that would be considered in the future. In conclusion, Sarah's following sessions with her therapist would consist of cognitive restructuring techniques, behavioral modification, learning new coping skills and relaxation techniques, and talk therapy. Sarah was to practice the new skills she learned and write journal entries at home to record her progress and monitor her thoughts. Sarah's therapist informed her that her progress would be monitored and termination of treatment would be dependent on her confidence and comfort in self monitoring regulating her symptoms. They had implemented psychopharmaceutical treatment to address potential treatment barriers in the future. Sarah was relieved to learn that her therapist offered financial assistance opportunities if she needed them. Sarah was confident that with dedication to her new treatment plan, she would reach her goals and find the relief that she had been seeking. Thank you for watching.